What are some of the biggest misconceptions people have with Medicare Part D? We have helped thousands of people with their prescriptions on Medicare, and we are always surprised at the misconceptions they have before they get properly educated. So, here are the 4 biggest misconceptions about Medicare prescription drug coverage. Let's dive in. The first misconception people have is a fear of deductibles with their prescription plan. Many times we're deep in a discussion with the client and we have found the right plan for them. Their drugs are covered, the plan's premium is low, and their drug copays are affordable as well. Then we let them know that the plan has a $500 deductible. All of a sudden, they no longer want the plan. The truth is that in most Part D plans, generics don't count towards the deductible. If you're on a handful of maintenance medications, you most likely don't have anything to worry about. Your copays will likely be low, and you don't have to sweat hitting your deductible and paying large out-of-pocket costs. This is not always the case, but this is what we see the most. So to summarize, don't fear a large deductible if you're on a handful of generic medications because chances are you're not going to have to pay that deductible. The second reason you shouldn't worry is because plans that don't have deductibles tend to be much more expensive compared to the alternative. You may avoid a $500 deductible, but the plan's yearly premiums may be over $1,000 for the year. So you're effectively paying $1,000 to avoid $500. That doesn't make much sense. So to summarize this first misconception, don't be afraid of a deductible on a Part D plan. In many cases, your prescriptions won't count towards it. And plans that have no deductibles are so expensive that they often aren't cost-effective. The second misconception we're going to dive into is there aren't any major changes year over year when it comes to your Medicare Part D plans. Many people take a prescription plan when they first enter Medicare and think, I'm good for a while. The truth is you may not have the coverage you need by next year even. Medicare prescription plans are in constant fluctuation. The drugs they cover can change, their premiums can change, their pharmacy network can change. Everything can change each year. And if you don't pay attention or don't have a broker to pay attention with you, you could be shocked. Many Medicare plans raise their premiums each year. Sometimes it can be double or triple what you paid last year. If you fail to notice, you could be stuck with these higher premiums for an entire calendar year. You can also see large spikes in your drug copays or find out one of your prescriptions is no longer covered, period. Every year, double-check your plans or go over it with a licensed broker to make sure you don't have any surprises. The third misconception we see about Medicare Part D plans is you can get more coverage by paying a higher premium. I can't stress how many times we have a new client come in and we start talking prescriptions, then they mention their prescription plan is close to $100 a month. We then ask what prescriptions they currently take, and they say none or a handful of generic maintenance medications that are low cost. We then ask, why are you paying $100 a month for a plan? What most people don't know is there are prescription plans out there that cost $10 or $20 a month that still give you amazing coverage. When choosing a particular prescription plan, you need to focus on what plan covers your particular set of prescriptions the best. What we mean by this is what plan gives you the lowest total out-of-pocket cost for your prescriptions. This could sometimes be the $100 a month plan, but the vast majority of the time it is the $10 or $20 a month plan. It all depends on your particular set of drugs. You should also know that a more expensive plan doesn't necessarily cover you better for future medications. Those expensive plans may not even list certain expensive medications on their formulary. You could be paying $100 a month for the plan itself and still pay hundreds in copays for certain medications. To summarize, a more expensive Medicare Part D plan does not inherently make it better. It all depends on your particular drugs and what plan is best for those. The fourth misconception we see all the time, and I think this one is the biggest, is all I need is GoodRX. When we take on new clients, sometimes they tell us they don't even have a Medicare Part D plan. They got sick of it and now only use GoodRX. Now, GoodRx is an awesome service, but it shouldn't be your only thing. Let's dive into why. The first reason is if you don't have a Part D plan for an extended period of time, you could start accruing penalties. And Medicare penalties never go away. You may think you're saving money, and you may be in the short term, but long term you could be burned by lifetime Medicare penalties. The second reason is GoodRx doesn't cover brand name medications quite as well as Medicare Part D does. The unfortunate reality is that brand name medications and specialty medications cost a lot no matter what plan you get. You can sometimes get help from the manufacturer or your state, but it is not always guaranteed. Many people think, well, my brand name medicine is expensive on Medicare, I'll check GoodRx. And in most cases, the medicine is even more expensive. Brand name medicine on GoodRx is often close to its full retail price. I looked up an expensive prescription, Eliquis, on both services for the sake of this video. On Medicare, the total cost of Eliquis for a month was about $45. On GoodRx, that price was $550 a month. To summarize, GoodRx is a great service, but it's not right for everything. You are better off running all your prescriptions on Medicare and then using GoodRx as a supplement to get a lower price on maybe one or two of your prescriptions. Now, we really hope this helped you better understand Medicare Part D and help you avoid some of the misconceptions our clients see. If you need any help, you can always reach out to us at www.njlifeandhealth.com or call our Toms River, New Jersey office at 848-226-6897 to speak with one of our licensed brokers. And don't let the NJ and NJ Life and Health fool you. We are licensed in about 20 states, so chances are we could help you out as well. And if you're someone who just likes to learn on their own time, our YouTube channel has a ton of great educational content, so check out those videos, like, subscribe, and let us know what videos you want to see in the comments below. We'll see you in the next video.